These are questions that we've received from our constituents back home, specifically about what's going on with the website and for them. And so what I'll do, I'd like to get those to you, but there's a lot of questions here and a lot of thoughts gone into a lot of these questions. But if I could start with last week's testimony when the four of the contractors were here. And in one of the questions that I had posed to Ms. Campbell from CGI, in her testimony, she had stated that they had delivered the Medicare.gov and also the federal reporting.gov. And I'd ask at that time, were these sites more or less complicated than the site that we're talking about here today? And she said, of course, the site today was more complicated. And in the questioning and from her testimony, we'd been hearing about this end-to-end testing that wasn't happening, that we had individuals out there saying that about 2 weeks had been done. But I'd ask her about, was there sufficient enough time when they did Medicare.gov? And the response that she gave me back was on Medicare.gov, which was a less complicated site. And she stated that we had sufficient time to test the system before it went live. And I asked her in a follow-up then, what was that sufficient time? And she said we had a number of months before the system went live at that time. And then, and I just want to make sure, because again, sometimes things don't get reported accurately, but in the U.S. News, there was a report on October the 18th of this year, and there's some questions going back and forth. I just want to make sure that, that you were quoted properly. It said, after 2 weeks of review, the HHS Secretary concluded we didn't have enough testing specifically for high volumes for a very complicated project. The online insurance marketplace needed 5 years of construction and a year of testing, she said. We had 2 years and almost no testing. Is that correct?
I don't know the quote. I'd never suggested that we needed 5 years.
Okay.
I don't know what that's from or what that...
Okay, well, that's one of the things I'm going to check.
We clearly did not ever have 5 years. The law was signed in March of 2010.
Well, and then last week, when you were down in Texas, you were being asked by a reporter about the system and the launch, and one of the parts of the question was that at what point did you realize the system wasn't going to be working the way that you envisioned before the launch, and why didn't we stop it before the launch? And again, this is what was reported. We knew that if we had another 6 months, we'd probably test further, but I don't think anyone fully realized both the volume caused such problems, but volumes also exposed some of the problems we had. Now, going back, though, to Ms. Campbell's statement that they tested more extensively on a system that was not as complicated, but HHS, CMS decided to go forward with only a very short period of testing. Do you think that was acceptable?
Well, clearly looking back, it would have been ideal to do it differently. We had a product that, frankly, people have been waiting decades to have access to affordable health care. Medicare existed well before the website. Medicare is a program that started 50 years ago. The website was an additional feature for consumer ease and comfort, and so they were not launching Medicare. They were not delivering health benefits to seniors. They were putting together an additional way to enroll in Medicare. I would suggest, sir, that we had deadlines in the law, that people had benefits starting January 1st. We wanted a extensive open enrollment period so that a lot of people who were not familiar with insurance, didn't know how to choose a doctor or choose a plan, had never been in this marketplace, or people who needed to understand fully what the law offered had ample time to do that. So the date that I was, again, required to select for open enrollment, that's, again, part of the statute. How long would open enrollment be? We picked that date. All the contractors that began early in this process, in the fall of 2010 when we issued, 2011 when we issued the initial contracts to CGI and QSSI, knew the October 1st date. That was not changed. It wasn't added to. As we got closer to the system, one of the reasons, again, that we pared down what needed to launch on October 1st was an attempt to minimize the risk to the system, to get people to their ability to see clearly what they were entitled to, what the plans were, and if they chose to enroll. Clearly, the testing should have been longer, should have been more sufficient.
Gentleman's time
Thank
has
you very much, Mr.
expired.
Chairman.